Nowadays, I don't judge anybody.
I won't say it. That was too much.
You're
All right.
fine.
Ready to roll?
Yeah. Good
Okay.
to go.
Do a quick little intro, nothing too serious. So,
All right.
sitting here, another episode of the podcast with the director and the owner of Hyperbarics Orlando and New Smyrna, Erika Jordan. Thank you for doing this.
Thank you for having me today.
Awesome. I appreciate you opening up your facility here and letting me come in and sit down and take some of your time. But I wanted to start with sort of why I wanted to do this, if that's okay.
Okay.
It seems like hyperbarics are getting more into at least what I consume, whether it's athletics, fighting, sort of longevity and recovery, those kind of things. Seems like there's more and more communication coming out about this. So kind of how I like to work is let me find somebody that knows a lot more than me versus doing random searches on the internet and just sort of sit down and have a conversation. So appreciate you again for letting me do this.
Perfect. Thank you so much.
Absolutely. So I told a couple people I was coming to have this conversation, and you probably have heard this before, but a lot of people are like, what is a hyperbaric chamber? I'm sure you've gotten asked that question a lot. So for people that don't know, could you kind of explain what these are and a little bit about what you got going on here?
Yeah, so a hyperbaric chamber is a medical treatment that you have a chamber that you expose someone with 100% oxygen, and then you pressurize the patient from increasing the percentage of oxygen, and then the pressure, that's what helps hyperoxygenate the body. From having more oxygen in the body, it helps with healing on so many different levels, from very chronic, serious conditions to nowadays we're seeing a lot of health and wellness conditions as well. Typically, you'd find these chambers on the hospital sector. Most major hospitals have at least two of them nowadays, and typically in their wound care clinics. But now it's becoming a lot more mainstream that people are using it for all kinds of conditions. So you're starting to see them more pop up on the private sector, which is great.
And forgive my ignorance. Do you have to have a script to come here from a doctor? Can you just walk into a place like this? Or
So that's a really good question. Oxygen, even though we all need it to live, it's considered a drug, especially when given in the medical forms that we are. So every patient that we treat needs a prescription. Some will have prescriptions from their doctors that they'll bring in and let our doctor oversee when they're writing their orders or prescriptions. But it's not required because we have a doctor on our team that he's trained in hyperbarics. So either for an insurance condition that we're billing insurance or going out of pocket with cash, everyone gets worked up the same way.
Okay.
So our doctor will write a prescription, basically a protocol of treatment, how often, how long, when to do revals and stuff like that. So that way we can give the best protocol depending on what we're treating. So it's all dosed.
Okay, but has to start with a doctor, either your own or you have one here that can do that for you.
Exactly.
Okay. You said something there that also one of the reasons why it's coming up on my radar, which is, a lot of people are getting more focused on what they eat, what they drink, what they do and don't eat and drink. But it seems like not a lot of people, you can go a ways without eating, you can go a few days without drinking, but you can't go very long without oxygen.
No.
So it sort of seems like maybe people take for granted, how good, even sometimes just breathing, but obviously we'll get into, the little bit more detail that you got going on here. But do you feel that there's like oxygen is looked over in people's overall health and wellness, I would say?
I would say that, like in the beginning, when I first started opening the office, I would get questions from patients. Well, how do I know I'm a candidate? And my first response would be like, well, do you breathe? Because if you breathe, we all need oxygen. Everything needs oxygen to live.
Right.
Same thing. So everyone needs it. It just depends on why we need it. Our protocols, if we're going to deeper depths versus, which the deeper it is, the more concentrated the oxygen is, the more acute, serious conditions.
Okay.
Versus, because too much of a good thing can be dangerous.
Like everything.
If someone doesn't have a major illness, you're not going to max out the chamber on them and put them at dangerous levels for someone that doesn't need it. But there's a protocol for anybody for whatever reason that can do it. And there's a lot of misconstrued of, oh, do I need it? Do I not? But it's the most vital thing that we all need to live.
Right.
And it's good for so many reasons. reasons. And we have so many people that are younger like ourselves that don't have a major medical condition, that they're on the mindset, why wait until something's broke to fix it? Why don't I just keep my body up as well as I can, as much as I can, from our professional athletes, high school athletes, overall business owners, just our average people, college students that want to do it just for cognitive, overall well-being. So there's a lot more. And in the 15 years I've been doing this, it's grown so much. And that's what excited me. When I started years ago, there were so many different theories about, it makes cancer grow. It's dangerous for this. You can have seizures. Yes, when it comes for cancer growing in it, no, that's definitely, all hocus pocus type stuff. Nowadays, we treat a lot of cancer survivors that are recovering from chemo and radiation, some that want to do it on a proactive way of cancer. A lot of cancers can't grow or spread in the presence of 100% oxygen. So there's a lot of different things that used to be said, but nowadays it's more mainstream. Doctors, it was hard to get a doctor at the hospital to refer a patient on the private sector, because unless you were basically dying, about to lose a leg, tried everything and it didn't work, then they'll do hyperbarics. Most of the indications for the hospital, they would not put their name on a prescription for something that's considered off-label. Nowadays, we get docs from the hospital that send their patients for migraines, for difficulty healing with wounds, just, Lyme's disease, chronic fatigue syndrome, all different types of things, because the awareness of it has grown so much.
And probably the data, right? As far as you see that a lot with the medical community. I mean, It wasn't that long ago where some doctors would write cigarette scripts to people, and obviously that has changed very, very dramatically. But in your 15 years to see this grow, that's got to feel like you made the right move. But what got you started in this? I mean, 15 years is a commitment in time, but how'd you get started in all this?
Well, it's just I was at the right place at the right time, I guess. I was going to school at night for ultrasound, and at that time I worked as a server trainer for Cracker Barrel, and was done with working with people's food. And because I was doing a medical degree at night, I decided I wanted to do something different during the day. So I actually saw a post on Craigslist for a babysitting position for a physical therapist.
Okay.
So I went to the physical therapist's office, and he knew that I was going to school at night for ultrasound in the medical. And he's like, well, I would love you to watch my children. I think you'd be great, but would you like to work in my office instead? Of course, being younger, 18 years old, I'm like, well, is there a pay difference? And pay was going to be the same. So I'm like, okay, to work medical, which what I'm doing, or, work with screaming kids. Okay, I'm going to go this way. So I started as an aide, and I was, picking up trash, ultrasound gel towels, just doing the grunt work at the office. And he also had hyperbarics there. And he did a lot of neuro rehab with traumatic brain injury, sports. There was all kinds of stuff that was going on. And I used to always love to be a fly on the wall, hear other patients. And it would just make me super excited about seeing these patients get better. So as I went through my schooling, when I actually graduated, I was about to go start my career in ultrasound. I was trained in echo, general, OB, and vascular. So I had a job already set up, Mount Sinai, Miami Hospital, great job for my clinicals. And their hyperbaric operator quit their job or got fired. So then my boss was like, hey, I know you went here, you got your degree, but would you like to come work and run the hyperbaric department? I would love to. So then I started there as just an operator. They sent me for more training. I got my licenses, ended up growing to safety director and also manager of the physical therapy office as well.
Wow.
And I was there for almost 8 years before I went to the hospital sector. And just, embraced it.
Multiple sectors, started at the ground level, and now here you are with
Yes,
2 properties that you own now, right? That's fantastic. What a cool story.
Thank you.
And obviously, over that time, I mean, what are the, obviously there's some rules. We can't talk about specific people, but what are like the most common, I guess, patients that you get in here from a treatment standpoint? I mean, what's their... What like maybe the top couple that you see in here the most frequently?
Yeah, it's tough because here we see so many patients. We actually have more chambers here than any hospital in Central Florida.
Really?
Most hospitals, all of the ones here currently have 2 chambers. We have 4, and we're busy all day long. So we see all kinds of cool stuff. I would say the most common things we see is a lot of radiation patients from surviving cancer, especially on the breast cancer, when they have radiation, have mastectomies, and they have difficulty healing. swelling, they can go in the chamber and actually heal their breast. We've saved so many nipples which to guys it may not sound that extravagant.
Should be on a
depends
t-shirt,
on the guy.
you know?
Yeah.
You could sell merch that says
we
that,
can do
probably.
all kinds of stuff. But, to a male, it might not be as, significant. But to a woman, because when you lose your breast, if you lose everything, that's just taking away part of your body.
Sure.
Or part of your life. So I've had, nipples that they're blue because they're dying with blood flow compromised because the radiation doesn't just get the bad cells.
Gets all your
It gets
cells.
the good cells, too, around it, which makes it harder to heal. So we can put them in the chamber, and within 20, 30, sometimes 40 treatments, we can completely heal them up. No need for any additional surgery. And now they're free of cancer. They survive the side effects, which sometimes that's almost worse than the cancer itself, and get back to normal. And it's covered by their insurance. Medicare and most commercials cover 60 treatments per calendar year, which there's only a few things that the insurance actually covers. So that's great. Besides that, we do a lot of people for overall health that just want to, one body, one life, heal faster. Nowadays, we're doing a lot of COVID recovery patients, plastic surgery. Central Florida in general, especially this Dr. Phillips area, there's plastic surgeons almost on every block.
Oh, yeah.
And a lot of times in plastic surgery, the doctors won't refer the patients for hyperbarics to the hospital unless there's a complication. So now these docs are leading the standards of medical treatment, and instead of waiting for a complication, they're requiring them to go in the chamber before their surgery to pump up their body with oxygen. So when they make the incisions, there's more blood flow. So that helps already with the surgery. And then it's right after surgery, they go right in the chamber.
For healing.
It helps with bruising, swelling, pain, collagen production, great for scarring. Overall, I tell the patients, your results are going to be the same as far as what it's going to look like because you've got the best doctors in town. What this is going to do is make the worst part after surgery better. So again, the patient heals faster. They have less complications. It goes great for the doctors. They have less, concerns with their patients. So we treat a lot of them as well. So it's pretty interesting, but such a wide spectrum of what we treat.
Yeah,
here.
seems like it. Keeps you probably on your toes from a patient-to-patient standpoint.
For sure.
So for treatments, right? You mentioned insurance can cover 60 treatments in a year. That seems like a lot. I mean, walk me through what is the treatment amount of time? I mean, what would it be considered one treatment, I guess?
Yeah, treatments are considered per day. Most insurance, the insurance companies have protocols based on your diagnosis. So a lot of them are around 2 hours in the chamber, once a day, Monday through Friday. And a lot of them, the minimum protocols are 20 treatments. Most of them are 40, once a day, Monday through Friday. Again, now they're coming every day for 2 months. Some of them even longer. I've had patients with really severe diabetic wounds that they're continuing to get better, but it's just taken forever. They've 60, 70. I had a gentleman that had his leg taken off by a Lamborghini because of, he said, a tree that was there that wasn't there before. He was a really funny guy. He's amazing. He had a 1% chance of keeping his leg. And the doctors referred him with hyperbarics and more surgeries. He saved his leg. He's out traveling the world right now.
Wow.
I think he was in his 35. He was pretty young when he started treatment. And 100 treatments. All covered by his insurance. So the more significant the condition, the longer it can take. A lot of these patients with wounds, with him it was an acute situation, a car accident, but these diabetic wounds, a lot of them had them for years. I've had patients that have had wounds for over 10 years, and they're having wound bags, they can't take a bath, and then they add on the chamber, and they're healed within 2 to 3 months, which sounds like a lot, but when you've been going through it, it's really
I'm
not
sure that's
that
short,
much.
considering what they've been going through.
And it's not that they didn't want to go to the chamber within that 10 years of having the wound. The insurance dictates of when they can go in the chamber. So unless they meet to their threshold or their requirements, they're okay, well, yes, you've had it for 10 years, but it hasn't, on a scale of 1 to 5, it's not a 3 yet. So until you get to that 3 out of 5, which 5 is typically amputation, then you're not a candidate. So even though they know it would help them, the insurance won't let them do it. So a lot of times it's not neglect from the doctors, it's not malicious. It's not that the patient doesn't want to do it. It's just they can't.
Interesting. I honestly, coming in, didn't, and I was reading in your waiting room, you have all these cards in there from previous patients. Sounds like all this. Thank you. I wasn't anticipating how much, I suppose, it impacts people's lives like that. I mean, going from obviously the cancer, the radiation side, the improvements there, definitely an improvement in life. But even something like not getting your leg amputated, a complete
Exactly.
life-altering treatment right there. Very cool.
It's very beautiful to be a part of it.
Yeah.
I say we do the easy job. We're just pushing the buttons on the outside. But the patient satisfaction that you get from working here, you can't put a price on it.
Sure.
And that's why I loved it so much on the private sector, and then went to the hospital sector and decided to do my own thing. And just the day-to-day benefits we get, and, hearing babies cry for the first time, saving breasts on our cancer patients, surgery patients that just got the butt that they've always wanted, and now they're shaking their butt as they leave the room. Like, it sounds so silly, but that could have been their dream their whole life. They finally saved up, they got it. So from stuff that seems minimal to amazing miracles, patients walking for the first time with neurological issues.
Wow.
Again, it's not it's not the chamber itself with a lot of these major medical conditions. It's an adjunct therapy. It's like baking a cake. You can't bake a cake with just eggs. You have to have flour, oil, water, everything done together at the perfect timing will make your beautiful cake. Same thing with the healing, with the therapy. The chamber itself does a lot of really good benefits, and yes, for people that don't have major concerns, it does great things. But when you go to these chronic conditions, other therapies, maybe surgical intervention, antibiotics, different things like that, when they combine them together, they enhance each other and get the results that we get here.
Interesting. I like the analogy with the cake. That's a good way to put it.
I love cake.
So, nice. What's your go-to cake?
Chocolate cake and white icing.
Cake. White icing. Interesting. I'm a cheesecake guy. Not much into sweets, but cheesecake. It seems that's probably my go-to. But so you mentioned athletes, right? I've had a few professional athletes on the show. A lot of fighters. Some people that I talk to. It seems like there's a growing in that community, let's say, of aging athletes that are, I think LeBron James has one of these in his house. Russell Wilson's an NFL quarterback. He bought 2 of these, I think, in 2017 or something. What is it that it's doing, and why do you see athletes come in here for that same type of benefit? It seems like there's some performance related, some longevity related stuff. What is it for athletes specifically that they could benefit from this treatment?
Yeah, so we see athletes on all different types of sectors, from high school athletes, what athletes just getting into their field, to current athletes that are playing in the NFL, to retired athletes. Performance, and then also recovery.
Right.
Performance meaning that not that they're going to go and it's like a steroid or anything,
right.
But when you have more oxygen in your body, you feel better. You can push yourself a little bit more and perform better. So we get a lot of athletes that want to do it in between their games when they're trying to recover, especially when they got them back to back, just to get their body to the fullest. Just like nutrition is important, sleep is important, their exercise is important, the oxygen is very important for recovery, for performance, but then also recovery.
Right.
Recovery, either they get hurt in a game. We get a lot of high school athletes for when they have concussions. That's a big things, and a lot of them, the high school athletes, their future career relies on what they do in high school. They have scholarships on the line, so it's very important. Besides, of course, their health and making sure their brain's intact, they want to get back in the game so they can get their scholarships and continue more. A lot of other athletes that want to recover because they push themselves or may have a soft tissue injury, a sprain, a strain, a broken bone can heal up in 75% faster. God forbid they have a concussion. Post-concussion syndrome's a real thing, and we can help repair the brain with oxygen to get it functioning back to normal states, so they won't have the symptoms. And then with our older athletes that are retired, there's the fear of CTE. Some athletes have committed suicide. Dave Durson, donated his brain to science, and they determined all these things. So they're worried about all these hits over the years, and you're fine, get back in the game.
Suck it up.
Suck it up, and you're kind of a wuss if you went off to the sidelines years ago. Nowadays, we're a lot more advanced in helmets and padding and stuff like that, but it's still a real thing. They want to just repair their body and be more in a normal state, so that way they can live longer now that they're retired.
And awesome that this solution is here now, because when the first conversations around CTE came out, it was like, there's nothing you can do. There was no treatment, and they only found it post-mortem right after death.
Exactly.
That's the only way they could determine it. But more and more change is coming to that. But that whole TBI, traumatic brain injury, scares me. I got a 9-year-old. He started playing football, tackle. I tried to talk him out of it because I said, if you look at a lot of older athletes, sometimes they don't move around the best. The memory, what we know about concussions, even from minimal brain injuries, riding jet skis, I think has been proven to have some issues there. But
can do it.
yeah, so that one scares me with a 9-year-old, and he was one of the best players in the state of Florida at 9 years old. He's doing really well, and I don't want to tell him what to do, but I wanted to warn him. So, I guess that's sort of what piques my interest when you hear about some of these treatments that are coming out now, and you hear about obviously some of the horror stories, and me trying to think about how I would manage that moving forward. But very cool to be a part of that, and from a cutting edge standpoint, because that's fairly new, right? Where this has some benefit towards that, or has that been around for a little bit?
It's been around for a little bit. It's becoming a lot more mainstream now for science, but there's a lot of SPECT brain imaging that we are doing on patients that show when they've had hits or trauma. We can see areas of the brain that were affected by it, have them go through treatment, a series of treatment, a lot of them 40 treatments, and then repeat the scans, and we show activity improvement in the brain of where it's repaired itself. As far as like for treatment options, you're right, there's not much for patients. There's 14 indications that most insurance companies look at as gold standard for treatment: the radiation, the diabetic foot ulcers, crush injuries, different things, very serious, more chronic conditions. Not that a brain injury is not serious or could be chronic either, but it's still deemed experimental. So let's say that we weren't here and your son had a concussion or a traumatic brain injury, and you knew that it was going to be gold standard for him to go in the chamber, and you contacted your local hospital and you found out the cost was $7,000 of treatment, and that's your baby, you're going to pay for it, you want to do it. They won't let you do it.
Even if
you
wanted
to pay out of pocket, they won't let you. They will only treat what's covered by the insurance. And that's what I noticed when I worked with the physical therapist for so many years in the private sector. My next goal was to go in the hospital sector and continue to grow in the hospital and make changes in safety directors. And I started noticing the different I wouldn't say flaws or, gaps in treatment options. And even like, let's say someone was cancer survivor, had radiation, has the blue, area that's not healing, and they don't have insurance and they want to pay out of pocket. They can't get treatment there because there's no insurance. So that was kind of like my motivation to be like, that's not fair, which you can go pay out of pocket for an x-ray. It doesn't make any sense, but it's still a growing field. So I know hopefully over time, they'll start opening up for other things, and people can choose to pay out of pocket, but as of right now you have no option.
That would be challenging in that sector, I'm sure, when presented with that situation, and there's nothing that can be done.
No, and it breaks my heart.
I bet.
And there's been times that I came home from the hospital crying. My husband's like, "Oh, why are you taking it so upset? There's nothing you can do about it." But
hard
after
to just
10
forget
years,
that,
I quit my job effective immediately and decided to open up my own place.
Wow.
And that's what's the best about us, I feel like, is we have all the worlds. We're credentialed with Medicare. We can work with commercial insurances, but yet we can also do out of pocket.
Right.
So we give everyone the option. And sometimes they'll come to us and they won't even know that it's covered by their insurance. And we're like, well, why don't we go through insurance? Oh, I didn't even know. Because we specialize in it, we're never going to bill for anything unethically. Right. We'll always make sure they have the condition. We'll pull the medical records, pull whatever scans and anything else we need it to justify insurance billing. But we can go that route. Or in an event, they have a $20,000 deductible. They can pay, $300 out of pocket and do treatments that way instead of billing it the insurance and still save a lot more money.
Wow.
So it's very interesting, and there's options for the patients that choose to come here and other private sectors as well.
Got to make it more rewarding to not have to tell people no, to not have to be like, this will help you, could help you, but nothing we can do.
It's like dangling a carrot in front of their face
that they can never eat.
It's like, this is what you really need, but you're not a candidate. Wow. And that would be things I would see at the hospital, because in the wound care, you'd have different wound care rooms, and then you'd have the hyperbarics in the back, and everyone would be scared about the hyperbarics dark room and everything. But every once in a while, you see patients poking in your room, like, oh, can I go in there? Oh, sir, let me look up your information. Oh, well, yes, it would help you, but you can't go in here because you don't have an infection yet. Well, I've had my wound for 3 years. Well, I'm sorry, because the infection hasn't set in, you're not a candidate. So telling people, yes, this would help you. These are all the benefits. They get excited, but no, it's not for you. Not that it's not for you. Your insurance says no, so you can't have it. And that's what broke my heart with a lot of things. Very passionate about it.
Yeah, I can imagine. Back to the brain for a second. Your young lady out front, 2 weeks with you. What was her name?
Emma.
Emma was telling me
Sweet
about
Emma.
anxiety and depression. Is there some research and data that suggests that hyperbaric improves that for individuals as well?
There is anxiety, depression, a lot of different cognitive conditions as well.
Yeah.
Even on the sector of brain damage from alcoholism, drug abuse as well. All these things that are cognitive related. It's basically dementia. Yes, there's a lot of studies that are coming out, especially nowadays, with getting patients in treatment sooner than later to either halt or decrease the effects of dementia, the early onset. I've had some patients that didn't even know their name, didn't even know their wife's name, and after a series of treatments, they're back to making phone calls.
Really?
They're back to normal. They're not doing cartwheels and backflips,
right?
But their cognitive improved to a normal level of them.
Wow.
And hearing a patient say, "Oh, well, I have my husband back. I have my wife back." Seeing them smile for the first time when they've been in just a stare for a while with depression and all these things is pretty amazing.
Yeah.
And we treat a bunch of patients on the cognitive brain level of all different sectors.
Nice. You hear a lot about, and this is what her and I were talking about, which is obviously the opioid crisis. And I know that's a sore subject for people, but like the fast script to just sort of, I don't know. I'm sure there's benefits. I'm not in that space to be able to say, what's good and what's bad. But it does seem like there's a large rise of people that can't get off of those things, for whatever reasons. So to hear that there's other treatments for people that are experiencing those, I'm just the kind of person that would explore all options before I start taking regular medication.
Exactly.
I don't know if that's everybody, but that's just it's interesting to hear that that data is there and that science is coming
And we
through.
actually have a lot of we do a lot of work with local rehab facilities as well, that they'll actually incorporate hyperbarics with their treatment programs. So they'll do different types of pharmaceutical type detox. They'll do other wellness, yoga, all that good stuff.
Nice.
But then they'll add in hyperbarics, and they'll actually drive them to and from their clinics. They'll have special drivers that will bring them, because with the oxygen, it's not a temporary fix. It's going into the body, it's creating new blood vessels, it's stimulating the brain to reconnect how it should be, because basically, you see the brain on drugs, the frying pan with the eggs. It's pretty much like that. The brain's going crazy in there because it's not wired correctly anymore from all these toxins that we've exposed.
Right.
So when you go in the chamber, and over time, the oxygen kind of resets the brain so it can work better. It's firing better. It's working where it needs to be. And it's not just okay, you're better now, and in a week, poof, you're going to be back to where you were. No, it's not a Band-Aid. It's actually healing you from the inside out, so that way you have long-term longevity from it. Of course, it's not the miracle drug. It's not that you go and continue to do drugs or you hit your head or something. Things can happen. Again, it's not the health helmet.
Right.
But whatever benefits the patients gain from treatment, they're still going to continue to heal right after their treatment, because they still have so much oxygen in their body. And then wherever they plateau or the benefits they gain, that's where they're going to be. Of course, also when you go to your dementia patients and stuff like that, it's going to halt the progression and decrease the effects from it as well. So as we age, some things, it's not going to stop you from aging per se. Your body, your genetics may change.
Right.
But as we continue to age, it may come back to it to an extent. So it just really depends on what we're treating.
Yeah. And dementia is a sore subject for me. I think I told you on the phone when we talked. My grandfather was a doctor locally here in the 60s, 70s. But he got dementia, maybe in his late 60s. And by 70, he didn't know his children, didn't know who we were, but then lived to 94, with, body was fine, just mind not so much there. So I guess that's what keeps me interested in if that runs in the family, obviously genetic condition could be, is it something that I need to think about, or for my children to think about, as new technologies come out, is again, part of the reason why I wanted to come and talk to you about it. So cool. let's see. So the treatments, right? If you come in and do 40, 50, 60 treatments, post that, is there like a long-term benefit, I would say, or does it wane over time? I mean, like, I guess it depends on the condition, I would suppose.
Yeah, it
But
depends on the condition. Of course, if you're coming for a wound that's having complications for years, and we heal the wound, it's not that 6 months later the wound's just going to open up,
Yeah.
and it's just going to come back to how it was. Of course, if they get a skin tear, they cut themselves, cut their toenails too short, and get a tear, it can still be compromised. I would say that it wouldn't be as bad as the wound before, because now they have so much more blood flow from the regrowth of new blood vessels.
Yeah.
So it may be harder to heal, but won't take as long, maybe not get infected.
I see.
Different things like that. And when it comes for like our brain patients, a lot of times we'll get to a certain area where quality of life is tolerable, where you're never going to get 100% recovery when it comes to the brain.
Right.
Unfortunately, I would love to say that. I'd love to, promote that, but it's not realistic.
Yeah.
But sometimes even a 20%, 30%, 80%, it makes your
That's
quality
significant.
significant.
That's significant.
Significant.
Yeah.
That makes your quality of life a lot better, and they'll still continue to stay where they're at whenever they complete treatment. Of course, if they still have deficiencies in speech, gait, they'll still need to continue physical therapy.
Right.
Strengthening, speech therapy, stuff like that. Some patients, after they treat or do a series of treatments, they'll come back for more of a maintenance type schedule. They may come back. A lot of them come back once a year around their birthday, and that's a reminder for them. Like, okay, let me do 5 treatments just to give myself a boost.
Yeah.
I have some that they fall in love with it, and they want to come back as much as they can. Sometimes after you have so many treatments consecutively, we'll say you need to take a break. Typically 60 treatments is our mark, where we want you to take a 2-week to a month break. Just again, when you're pushing yourself so hard so long, you got to let your body bounce back, recover, and then do another series if you want to. So I have some that I'm like, okay, you've done so many already consecutively, you need to take a break, of course, by the discretion of our doctor.
Right.
But it just really depends on why they're here, what results they've had, what more improvement do we have to gain from it, to really determine a maintenance type plan for them. And we'll go over all that with them. They'll ask us like, oh, when should I come back? Sometimes they might not need to come back. It's like, well, if you want to come back because for overall health, you can. But we'll have sudden hearing loss patients that their hearing is back to right at 100%, 98%, and they'll just love it. It's like, well, we healed you for your hearing loss, but you still love it because you get other benefits. The oxygen doesn't know why you're here.
Right.
As long as you're breathing, it's going everywhere in your body. So it's hard to give a straight answer on that one. I have some that do it for migraines. They'll come in when they'll have sensitivity to sound, light, they'll be nauseous. Whatever medications that they're prescribed won't work for them. They'll come in the chamber within 30 minutes. It's like their eyes open up. They're back to normal because the oxygen helps the brain. A lot of studies show that migraines can be from not having enough oxygen in your brain.
Lack of oxygen.
Exactly. So then they'll do fine. And they're like, well, do I need to come back tomorrow? Well, if your migraine's fine, see how you do. A lot of times they may go from having bad flare-ups every day to, once every 3 months, once every 6 months. And then they just pop in whenever a flare-up comes. So different things like that. It really depends on how the patient's doing to give them a realistic protocol even after they're done with their treatment.
Some people come in, do some treatments, and they're good. Other people, it becomes almost a part of their life to an extent, based off of what they're getting out of it, what they're trying to accomplish.
And as long as every time they're getting improvements, especially on these very serious brain injuries, they'll come and do 40. And, time-wise, life, other factors, it's hard to commit to every day. It's a lot. Money can be a factor as well. So they'll get so much benefits, continue to do things on their own, and then they may come back the next year. Okay, last year I was in a wheelchair. Now I'm on a walker to cane to no assistance needed over 5 years. It may take time. So as long as they're continuing to get benefits and the goals are realistic, we will continue to educate them on that one to make sure they get the best results.
Okay. And we touched on this on the phone, but the study that came out of, I think it was Israel we were talking about, where some people are doing X number of treatments in an attempt to, is it lengthen their lifespan, or it's the telomere lengthening, right? And I'm not 100%
Exactly.
sure on the science behind it, but they test pre and they test post of telomere lengths, if I remember correctly, and that somehow has some sort of indicator in
And
longevity almost. Okay,
Exactly.
and
Yes.
from your perspective, if you could explain that
Yeah.
one, yeah.
So the study was done from Dr. Efrati. He's a pioneer in hyperbaric medicine out of Israel. He did a lot of publications for curing MS, to longevity, to stroke, all amazing things. This most recent one, which is most common here that everyone's asking about, is the longevity, the anti-aging protocol.
Yeah.
So it's 60 treatments consecutive, once a day,
60.
Monday through Friday. So it's a long protocol. And then, yes, they did do testing in the beginning. They did them at 30 treatments and then at 60 treatments to show the results over time. And their telomeres, there was significant changes in it. Of course, you're not going to go in there looking like your grandpa and come out looking like he was 18 again.
Well, that's what it sounded like.
Yeah,
No,
it sounds like it.
no.
You may, as far as wrinkles, collagen production, you may see little changes, changes, hair growth, stuff like that on the beauty side. But it's not the outside really that really feels it. It's
Internal.
the inside. It's your cells. So as we age, our telomeres decrease, and that's just normal with aging. To make it simple. And then so with the chamber, they are noticing the telomeres increased in length. So that showed that the DNA would go longer, as if you were reversed in age. And they would even with the different testing, they could say, oh well, your cells are showing this is equivalent to the age of a 45-year-old, or you may be 45 but your cells are showing that you're 70 years of age. How is that even possible? That's possible because that person may not have had the best lifestyle.
Right.
They may have drank, they may have smoked, maybe besides nutrition, they've got multiple head injuries because they played high school sports their whole life or whatever. Just different things as we age affects our longevity, and it can decrease it. Same thing with if you have two twins, they may have the same number of stem cells at birth, and one may have a beautiful, perfect lifestyle, never got hurt, never got sick, never did anything bad. The other one experimented a little more, maybe got hurt, you never know.
Yeah.
And then by the time they're both 40, one may be, have cells the age of a 25-year-old, and the other one may be at 70 just because of factors,
How they live their life.
either things that they did or things outside of their control that may have happened that could do it. So that study, it's very powerful. We've gotten a lot of patients. We actually had a gentleman in here today that he's diving right now. He came from Saudi Arabia to have treatment. He just mentioned, he's like, I traveled all the way to Saudi Arabia for you guys. I'm
Really?
like, that's amazing.
That is amazing.
Yeah, we get patients from abroad all
Yeah.
the time as well, but he saw something on Netflix about the Efrati study and then looked us up, decided he wanted to take a trip over to America
Wow.
and came in just for that study.
For that
itself.
purpose, from
Yes, sir.
wow.
Yes, sir.
Wow.
And so we can do, of course, we're not an Efrati clinic. We are familiar with the protocol. There's air breaks in the treatment itself, which air breaks sounds a little interesting because it's like you're
I
having
only know it on
air-
like a big truck, that they got air brakes,
Yeah, so
Yeah.
basically it's changing the exposure of oxygen while you're under pressure. So they would be in the chamber for so long breathing 100% oxygen, and then they would do an air brake. So they would have a mask or hood that was pumped to regular air, what we're breathing right now, 21% oxygen. So going from 100 to 21, it offsets the body, kind of like stimulates it to make the body work harder to want to be better, to get better. So it has multiple air brakes in the protocol, which are all 4 of our chambers, even our new Smyrna chambers, are equipped with air brake capabilities. So we can do a very similar protocol for our patients.
Okay.
And we've had a lot of them do it as well and had some really good results. Some were doing the telomere testing, some were doing SPECT brain imaging, some were doing both, and we were seeing improvements in brain, day-to-day cognitive and fine motor function improvement, as well as DNA results from their testing as well.
Okay. When you have people, again, for a variety of reasons, but come out of there for the first time, I mean, what's some common reactions, or is there is that too soon? Does it take more? I mean,
I think it depends on the condition.
Right.
You know,
Yeah.
the more chronic condition, you know,
Yeah.
they've had it for 10 years and they come out the first time like, well, I didn't notice anything.
Hmm.
Well, you've had this for 10 years.
Yeah.
So, you know, if it happened in one treatment, everybody
Yeah.
would be in here.
Sure.
I need a lot more chambers than that.
That's right.
But, you know, they may notice like they're a little bit more tired just because it's like your body's running on Red Bull. It's like Red Bull for the cells. You're working so hard even though you're not doing anything physically. Some are still doing things physically outside, but the chamber can make them a little bit more tired. They'll sleep really good, most of them that night. And just overall, like sometimes patients will say that they have more clarity. I would say more so the younger patients that don't have major medical conditions, they'll notice they get up a lot easier off the bed. They sleep really well. They'll notice things
that.
a lot faster because they don't have any major things going on versus the one that's, you know, a chronic patient. Our surgery patients, when we treat them right after surgery, within 3 treatments, their pain can go from a 10 out of 10 with taking pain medications to not needing any pain medications and not being in pain. Of course, they still may have some swelling and bruising. It's not like they're, you know, bikini modeling right after treatment. There's still time with healing, but they will notice major improvements. And that's why a lot of times, especially with surgery patients, when they come here post-surgery for whatever reason, they'll never have another surgery without including the hyperbarics because you can notice a major difference in a short amount of time.
Wow.
So it just really depends on
the condition and situation,
Yes.
age, a lot of factors go
Huge
into
things.
that. I thought I heard you mentioned stem cells. And again, I could be wrong, but I thought I read something where stem cell treatment is growing. It seems, you know, used to have to go to Panama or South America to get
abroad.
treatment, travel abroad. I think they're doing some in Texas, some other places now. But isn't it? And again, I could have been off on this one. Wasn't there some recommendation that there's some benefit to hyperbaric post stem cell treatment? Am I off on that one?
Yeah,
Or
well, there's a lot of factors when it comes to the stem cells. So, and there's a study from the University of Pennsylvania that when patients do 20 treatments consecutively, they actually rebirth their own natural stem cells.
Their own stem cells.
Their own stem cells by a factor of
Interesting.
800%.
Holy, that's a big
So
factor.
stem cells are huge. They're the miracle cell. They go to the body. They help heal things. People are paying a lot of money for it.
Yeah.
So stem cell production goes hand in hand with a lot of conditions that we treat, even for our chronic wounds. It helps them heal. But we are seeing a lot. National Stem Cell Institute here in Florida. There's other major stem cell companies that are doing it that will actually recommend doing treatment right before to help promote stem cell production. Then they'll do their stem cell therapy and then do the chamber right after as well. So that will help especially if you're spending so much money for the procedure. Why not enhance it to make it the best it could possibly be?
Absolutely, especially with data like that coming out.
Exactly. It's a no-brainer.
Right.
So a lot of these major national companies are actually requiring it. Some of are even putting their own chambers in their stem cell treatment centers there nowadays, which is huge. And then we have some that may want to wait for stem cell therapy to do the chamber to see how they feel with their own, and then maybe enhance it at the end. So there's a lot, and with stem cells, we could talk about that for hours. You know, there's medication-derived stem cells, there's fat-derived, there's cord blood, there's all different types of ways of doing things abroad. Here in the States, we've got limits in the States of what we can do versus going abroad.
And that's recent, right? To where somewhat recent, where it was even available for some sort of treatment in the United States.
Exactly. Exactly.
But it's like American doctors went down to those other countries. You know, it's their legitimate establishments. I think people think, I don't know what they think, you know, when you mention it to somebody, you know, that down there it's you know, like it's behind some alleyway. I'm like, I don't think it's like that.
They're doing it in like a dark corner or something. But no, Panama has a huge stem cell clinic there. There's, of course, a lot of benefits of staying in the States versus going abroad. I hear a lot of people go abroad because in the States you can't clone your own stem cells. You can't manipulate cells. So, again, if you can take out, let's just say 500 stem cells from your fat here in the States and they use that to put right back into you, you can go to Panama, again, just saying numbers. Now they can take that 500, clone it, now get 1,500 and put it back. So you, even though you have to travel, you get more bang for the buck.
Yeah.
I'm not a stem cell expert. I just heard a lot of different things when I hear patients, oh, well, how'd you do it? How'd that go? I know a lot of children that are starting to do it with children. In the States, there's not many places that will do stem cell therapy on children. So a lot are now traveling to Mexico to do that as well. So it's another growing aspect in our healthcare field that's getting a lot of good results as well.
It seemed like for a while, and there's different ethical thoughts on it, that people have, but it seems like it is helping people in certain circumstances, whether it's avoiding surgery, minor stuff like that, or even like, disabilities that you're born with, so it's just hard for me when some things get, it seems like suppressed, and you question the whys behind it. And again, I'm not pretending to be an expert by any means, but I do like that it's expanding and does seem, more part of the conversation than it has been, I think, in the past for people. So cool.
Exactly.
Awesome.
Yeah, it's really exciting. And again, what you pay for is what you get sometimes in different places. On the private sector, we're not regulated like the hospital is. So if you have, enough funding to buy your own chamber, you have a doctor on your payroll, you can kind of, as long as you're not dealing with the insurance companies, you can do whatever you want. So sometimes they're very cash driven, where they'll say, okay, well, for 30 minutes is this price, for 60 minutes is this price, a la carte, an extra 15 minutes, an extra $50. If you want your parent to go in with your brain injured child, an extra $50, which makes no sense to me at all. Because how can you, it's a medical treatment, it's a drug. How can you go to a clinic and say, well, this is what I can afford, this is what I want? But what do you actually need? Because you go in 30 minutes here, 30 minutes there, come in once a week for a brain injury. If someone's coming once a week and tell me they want to come in for 30 minutes, I'm going to tell them you're wasting your money and my time. And it's not going to happen. Our doctor won't allow it. Again, the protocol should be based on science, based on experience to get the results. Because when they're doing all this a la carte stuff.
Like a massage or like.
Like if you're going to a massage place, it doesn't make any sense. But then they go tell all their friends, well, I tried that, it didn't work. Well, yeah, it didn't work because you didn't do it right. You're coming in once a year for a brain injury. That's not going to happen.
That's not the protocol.
If you want to come in once a year for overall health, that's completely okay. We can do that. Again, we don't do the timing. You can't pay or tell us what you're going to time in the chamber. Of course, our doctor will prescribe it, and they may say 60 minutes, and the patient may have to come out early for a bathroom break. We're not going to say, oh, you have to stay in here the whole time. But the doctor is going to give the protocol based on science to help with, because we can never make sure that we're going to get the best results. So that way, when they do it here, they can go tell everyone that it worked out correctly. Some people love it, that type of mentality. Some people are like, oh, well, I just want to do it like this. Well, there's a reason why. Obviously, you don't have your own center and you don't have a license in hyperbarics. So how can you pick what you're going to do? You can't tell the doctor, you want me to take an antibiotic, but I'm only going to take a quarter of it whenever I feel like it. What is it going to do? It's not going to do nothing, more than likely. So that's what you really have to be careful. And that's one of my other passions is driving the education on it, the experience, and making sure we're not the only hyperbaric places in the United States on the private sector. There's a lot of really good ones. A lot of them being ran by medical professionals. They do safety checks. They're doing protocols how it should be. But then, just like anything, there's some that aren't doing it the way that
they're just trying to make money. Or?
Exactly. It's more so a money-driven type thing. Let them do it and just take whatever money and don't really care about what's going on. I've had some places tell me when I'm calling for other patients, because if they're traveling and say, oh, well, I know this center, can I go here? Sure, you can go there. And, oh, can you call and ask them if it's the same thing? Well, I'll just call and ask questions. And they'll say, oh, well, if we're taking cash, we don't need a prescription. Oh, so the rules don't apply when you deal with cash? Like, I rip them apart.
I bet. I bet.
I'm like, that doesn't make any sense.
Right.
That doesn't make any sense. But again, there's a lot of really good centers out there. We have a lot of information on our website. I even have a checklist that's free that people can download, and either I get people download it from all abroad in the States that may not ever come to us, but it asks certain questions on what to ask as far as safety guidelines, protocol questions, questions, doctor experience questions, stuff that most people won't even know to ask or even know they have the right to ask. Because my thing is there's plenty of patients out there. We need to raise the quality of care, raise the bar on care, so that way it will be more widely accepted and more of a gold stream standard in the future.
And try to, when possible, identify those ones that aren't maybe taking it to the same level that could be negative for what you're trying to accomplish overall. Makes perfect sense. And just a cool passion that you found yourself in, you know, on a lot of different fronts. Doing this podcast, I get to have these kind of conversations where it's like, I really enjoy finding out what people put their time into and like the whys behind it. And you got a really cool story here behind a lot of those different factors.
Thank you very much.
I have another question.
Okay.
So on the note of paying you in cash, no, I'm just joking.
Uh-oh.
I told you I surf. My family surfs. One thing for mostly for hurricane season, we prep some like breath hold work, trying to increase the amount of time you can hold your breath. We were talking about fishing. You know, if you think about like free dive or spear fishing, and I haven't looked, but is there like benefits to this type of oxygen treatment that would maybe help with like a static breath hold? And again, that's like a completely not medical related, not a treatment, but I was just curious I haven't thought of oxygen as like a drug, when you describe it like that, it makes me think of it. But would that be a benefit for like those breath hold times, like being able to hold your breath longer, I suppose, underwater?
I would say more than likely if you have more oxygen in your body. I don't know of any recent studies on that, but we'll look into it after this.
Okay.
Where if you have more oxygen in your body, you can perform better. You can hold your breath longer. So that way, because as you're holding your breath, your body's exerting itself. So if you already don't have enough oxygen in your body and you're holding your breath, you're not going to be able to hold it as long as someone that's not, versus you're holding your breath and you've got someone that smokes 5 packs a day trying to hold their breath. They're not going to be able to be anywhere as close to you. But then if you have you and then someone that's highly oxygenated from that morning, more than likely they would be able to hold their breath a lot longer.
Now that you mention, I do think that for like what they call static hold records and free dive records, there's 2 categories. There is a preload oxygen one, and there's just hold your breath normally. So I guess maybe I answered my own question there.
That sounds right.
Sometimes I think about how can I hold my breath longer, if I want to get into, spear fishing, kind of hunting underwater almost, be good to hold your breath longer.
And on that topic too, veering off just a little bit, people say, well, I'm a PADI open water scuba diver, so I can just take my tank and go diving. It's the same thing. Well, the chamber, it's very similar to scuba diving. It's equivalent in atmospheres of pressure. Most patients are dove as deep as 33 feet, some a little bit deeper, some a little bit less. And it's very similar, but the difference is the oxygen. But even if you're a nitrox diver, which increases the oxygen in your tank, it's still not anywhere close to 100%. It's still in the low 20s versus your regular air tank has 21% oxygen, 79% other gases. So there are technically benefits from even doing a regular tank diving, but you're not going to get the same thing as you are here. And that's what really helps promote that healing. Because I said, I'll just go rent a tank for $10 and it's going to save me versus a couple $100. Well, you're still breathing what we're breathing now, just pressurizing. So it does only take 0.01% of oxygen increase to change the partial pressure of blood in the body. But if you want to get to a therapeutic level to make a cellular change, you need to have a more potent oxygen percentage when it goes in there.
Got it.
So that's the main difference. And even bringing it back to the science of it, we're breathing 21% oxygen, 79% other gases. Every time we breathe out, we're breathing out 16%. So every breath, we're only taking 5% oxygen. Where is it going? It's going to your brain, your heart, your lungs. Where does it go last? Organs that don't need it. Smokers, they'll wrinkle faster. The skin's not going to need it as much as your brain is. Same thing, or opposite with the chamber, you're breathing and the pure amount of oxygen is actually 99.9 because you can't get 100%. The 0.1 is argon, which is an inert gas. But when you have that, very increased potency, and then you pressurize it, it actually brings that 100% higher. It can go up to 2,000% of oxygen deep into your body, into your plasma that's going everywhere.
Wow.
So when you have it to that extent, it's like, your tank on steroids. It's crazy. So we get a lot that, especially divers, people water oriented, like, oh, well, it's the same thing. Well, sounds the same as pressure, but it's the oxygen with the pressure that gets the results.
Got it. Yeah. That's funny. People come in and try to be like, oh, I can skip this and just do some scuba diving.
Yeah. And if it was the same benefits, I would have dive centers all over.
Yeah,
it would be a lot cheaper.
Probably, I was just going to say, less of an investment, I'm sure, doing that.
Yes, it would have been a lot more affordable, but this is what gets the results,
awesome.
And this is what works for us.
You mentioned earlier COVID, and obviously the season that we're in, probably for the foreseeable, who knows how long, right? Depending on, again, sore subject for a lot of people. But how does this play into, people suffering? You got that COVID long haul, you got a chronic fatigue that comes out of some, and it seems like it affects everybody differently, but what are you seeing from a COVID standpoint and how hyperbarics play a role there?
So there's a lot with COVID recovery patients or long haulers. To be clear, as a disclaimer, we don't treat anyone active COVID at our office. Yep. We have too many patients. It's a little bit too high risk. Unfortunately, we don't allow it here. In order for patients to come to us that are recovering from COVID, we need a negative test from an outside lab, not a home test, just to confirm, to make sure they're not going to expose any of our other patients. And then after that, we've had patients that come immediately after they have their negative test. And some, I had a gentleman in here who's from, I think, Georgia last week. And he was 6 months since his negative test, and he was having tremors. He was having fatigue, brain fog from it. Within 5 treatments, we brought him back up like 80%.
Wow.
Of his tremors had decreased. His fatigue was completely gone. A younger guy, and it can affect so many different people. They can be athletes, and now they're almost wheelchair bound because they can barely walk without needing, oxygen or breath, or they may be on supplemental oxygen and they've never needed it before. It can be ventilator patients, or patients that were on a ventilator before, some that were never in the hospital that have long haulers. But it's affecting, when you're in a hypoxic state, you're not getting enough oxygen, so it affects the whole body. The brain needs oxygen and you're not getting enough. Your muscles need it. Everything needs it. So when you're sick for a week or so, that's very traumatic on the body, even though you just think you're dealing with a significant cold almost. There's a lot of factors that a lot of patients aren't bouncing back. And with us, we're putting them back in the chamber, or putting them in the chamber and bringing all that oxygen into the body, and it's recovering again, not band-aiding, but just healing from the inside out these symptoms that happened before. I had a lady that she had tremors so bad, even giving her a water bottle, she couldn't even drink it. Water was everywhere. It was her son that was actually a doctor out of New York that found us, and his mom lived here. She couldn't even drive herself to treatment. He flew down here, drove her to treatment. Within 3 treatments, her tremors are gone.
Wow.
It's pretty amazing. Of course, the more significant recovery, they may need 10 treatments. Some that had just recovered from COVID, and while they're sick, they looked up and they found hyperbarics as an option, and they don't want to wait to see if they have long haulers. They just want to come in, give their body more oxygen, and bounce back faster. A lot of major hospitals are doing studies now with actually current COVID patients on ventilators. And especially at the time when there's a lot of need for ventilators and there wasn't enough going around, they were taking patients, and some were going ventilators, some were going hyperbarics. The ones that were going hyperbarics were never needing to be on a ventilator. They were decreasing their hospital stay in half, and they were walking out of the hospital like nothing happened. It was amazing. So a lot of major hospitals are doing it, which will make it more of a gold standard for the insurance. But as of right now, it's considered alternative medicine. So it's an out-of-pocket, even though hypoxia needs oxygen. It makes sense that that's what the insurance should cover, but they don't deem it as a standard therapy as of now. But with all these studies, I know it's only a matter of time till that one's more gold standard as well.
Is that your future hope for this treatment? And do you have other future hopes for this? I mean, as far as what would you like to see? I mean, over the next 10, 15, 20 years, ideally, you know, from this treatment?
Yeah, well, COVID recovery, I would love to see within the next few years get more of a gold standard, or just any hypoxic, you know, decline type condition. Because not just COVID, you have other colds and different things that can leave you in a hypoxic state that can benefit for. So it opens up a door for a lot of those type of conditions. In general, I would just say I would like it to be more of a gold standard type treatment for all kinds of things. Why wait until the patient is about to lose their leg to approve them to go in the chamber?
Yeah.
All those years of wound care therapy, pharmaceuticals, wound dressings, all antibiotic therapy with the infectious disease doctor, that adds up to a lot. And yes, especially on the hospital sector, it's expensive. $7,000. The insurance wants to make sure wants to get to the point where it's life or death pretty much before they allow it to do it, because the cost is so high. So hope if they adjusted it and realized that, well, over 5 years, I'm going to spend this amount, which if I spend this in, 90 days, it's going to balance out or even be even more affordable for the insurance, and it's going to be better care for the patient. So I think if they just open their eyes a little bit more to that, for whatever reason, they're not doing it. Again, there's big pharma, there's all these other things.
That was my next question,
we're taking
why?
away from them.
Yeah.
Why you need something natural.
Right.
So that's a whole nother topic as well.
You hate to think about stuff like that, but, unfortunately, sometimes you have to when there's that much money involved in things. Unfortunately, I think we're one of only 2 countries that allow even pharmaceutical companies like advertise on TV, and it's everywhere. Smiling people, happy people, looks great. I should just get on this medicine, But again, subject for a different day,
The symptoms.
Oh, yeah.
A sudden death. This.
Yeah,
and
thoughts
they
of
say it with a
suicide.
smile.
I'll skip that.
Doesn't sound that good.
Now you see my reservations to jumping straight to medication for things,
Exactly.
But I say this, and I've said this before. I'm a huge fan of the advancements in medicine. I'm not anti that by any means, but when there's that much money involved, sometimes it questions why things are being suppressed almost.
Exactly.
When it seems like there's clear data to the contrary.
Exactly.
So.
And I'm on the same mindset too. There's a time and a place for medications.
Right.
There's some really great medications. Are some conditions a little over medicated? Possibly.
Right.
In a lot of situations. And sometimes, why go straight to the pharmaceuticals when you may just change diet and exercise?
Yes.
And then you might not even need the medication, or you might not need as much by the time you get to that point.
Yeah.
So I'm a big believer on that one. There's a time and a place for everything. It's not just this is the only way of life and that's how it should be.
Right.
Because we even treat some infectious diseases like chronic refractory osteomyelitis. So basically that's chronic. You've had it for over 90 days. Refractory, you try treatment and it still persists. Osteomyelitis, bone infection. So if you have a bone infection, doesn't mean you can go in the chamber. The rule is you have to go through a standard course of IV or oral antibiotics. It could be up to 12 weeks, depending on the doctor that prescribes it. And then after you go through it, if you still have it, then we can put you in the chamber and do another round of antibiotics. It enhances the intake in the antibiotics and kills the infection. But why didn't we just do that
in the first place?
Yes.
Yeah.
So again, there's certain situations with it and stuff that it can enhance it, things that it may be needed at certain times. And, why when you go this route first instead of making them, because again, now they've been on antibiotics for 12 weeks, their kidneys could be failing. They could have all these other side effects from the medications that could have possibly been avoided.
And they have to do it again when they're getting treatment here anyways.
Exactly.
Wow.
They're going to have to go through it again.
Yeah.
So,
Interesting.
and that's the worst call too, because it's like, well, we know it can help you. Your insurance doesn't cover it yet. You just started your antibiotics, so we can either call you in 12 weeks to make sure you still have the infection, and then we can put you in there, or you can call us, and if you still have it, then we'll be more than happy to treat you with your insurance. If you wanted to go out of pocket, as long as we work the patient up, they can do that right away.
Yeah.
But when it comes to the insurance, sometimes it's like, well, you're not a candidate now. I hope I don't hear from you again unless you want to come in and heal faster out of pocket.
Yeah.
But more than likely, I can't help you until it's really bad.
Yeah. Okay.
And we get those calls too, that's terrible.
Yeah. One of those ones that keep you up at night, I'm sure. I was thinking over here, I'm like, man, sometimes with what you see through here and have to deal with through here, I'm sure children, adults, all different ages, people not being able to get what they need, it's got to probably keep you up at night sometimes. Not easy to just forget about.
It does, and it drives me to do more and to hopefully have more centers to help more people and just bring even more awareness everywhere we go to. I was talking to someone from Hong Kong last week through LinkedIn that was asking me questions. They're never going to come. They never had any interest in coming here for treatment, but they just had questions where they were going there. I love to talk to people because again, there's options for help. It's just knowing where to go and why to go.
Very cool. And here's a solution right here locally. And again, you've been very generous with your time here. We covered a wide range of different things, but anything that we missed or anything else from a messaging standpoint that you'd want to put out there? Like I said, I know we covered a lot of different things, but anything else you can think of that?
Me, I like to talk, so we could be here all night long.
We could be here,
we can talk about all kinds of stuff. But my main thing is that everyone can benefit from it. Even if you don't need it for any chronic reasons, there's always someone who knows someone that can do it.
Right.
So, at an event you think you might need it, or someone, do your research, contact your local hospital. Even our local hospitals here, we've got such a good relationship with them that they'll get calls for someone with a brain injury or a child that had a concern at birth and they can't be treated there, but they'll say, well, why don't you go to Hyperbarics Orlando? They'll refer them and we'll work together with different things. So there's always options. It can't hurt to find more, to seek out information, call different centers, you do your research before you go to different places, always ask questions because again, you want to make sure to get the results wherever you choose to go to.
Awesome. Well, very cool. Erika, again, this has been great. I really appreciate the time. My mind is blown, on a lot of different things we talked about here. But like I said, you got a great story, what you're doing here in the community and abroad, it seems like on a lot of different levels. It's amazing stuff.
Well, thank you so much for coming in and speaking with me today. I really enjoyed our talk.
Thank you.
Glad we got to speak together.
Absolutely. And if we ever want to do it again, we can talk more, stem cells or whatever else we want to talk about. So sweet. Cheesecake. Yeah. Chocolate with white icing, right?
Yes, for sure. That will work.
Awesome.